Okay, now we're going to talk about stroke or CVA, cerebrovascular accident. Here's a picture of a brain with a head, all right? So just have to let you know. So there are two types of strokes, all right? And obviously under the type of stroke, there'll be subtypes, such as if you have an ischemic stroke, meaning a blockage in your artery, so completely blocks off, all right, ischemic stroke. It just depends where in the brain where you're going to have it. So you can have like a brainstem stroke or parietal stroke or frontal lobe CVA, and that will show on a CT or MRI if you have that. So there's ischemic stroke, and that's the clotting, and then you have a bleed. So a hemorrhagic stroke. So you can have an aneurysm, which is a pouch on a vessel that could weaken over time and then burst. So that could either be genetic or it can just be just for other reasons that we really don't know. And so then that can bleed out. So when somebody comes in to the emergency room with symptoms. So what are going to be symptoms? So for a bleed, it's usually loss of consciousness, vomiting, and then neurological deficits, depending again on where the bleed is. But ischemic stroke, you're going to see more deficits. If it's a major stroke, like in the brainstem area, yes, you are going to have loss of consciousness, as well as a lot of other issues. If you have a small stroke in one side of your brain, maybe you'll have some speech garbled or loss of motor control on one side. So this is the ischemic stroke symptoms, bleed. So there are some overlapping. What matters is how we're treating both of them. So no matter what, when someone comes in, you have a stroke protocol. So the first thing you do is, number one, oxygen. You want to keep the brain perfusing as much as possible to keep that, you got to keep that O2 set up. 2, neuro checks. 3, a CT without contrast. And 4 is going to be your TPA, which is going to be up here for your ischemic stroke. If you determine from the CT scan that they have a bleed, these people need to go to surgery to fix the bleed. It would be dangerous to give TPA to someone with a bleed. They would die. There's a high mortality for brain bleed. Depends on the type of stroke. The mortality goes up depending on where the damage is and how much damage is done. So when you think of this, you think of a brain attack. It's like a heart attack, brain attack. You can have plaque in any part of your body, anywhere in your artery. If you have endothelial damage or inflammation, hypertension, long-standing hypertension, smoking, cigarettes, that increases your risk tremendously from having an attack or blockage anywhere in your body. So when you think of peripheral arterial disease or vascular disease, you think you can have a blockage in your arteries in your legs, or even the artery that goes up to your heart, your aorta, abdominal artery. You can have issues there too. So with the ischemic stroke and this kind of stroke, make sure you differentiate the two. So when that person comes into the ER, you are doing this. This is your 4th protocol, not 1, 2, 3, 4, and you're not giving aspirin yet. So if you determine it's an ischemic stroke, then down here you would probably give aspirin, and they probably will need to be on some antiplatelet, aggregate medication, blood thinner, if they have an ischemic stroke. But that's not done till after this. So you don't want to give anybody a blood thinner before you determine what type of stroke this is, because if it's a bleed, then that's not a good thing. Also, remember, these people that have this, let's talk about ischemic stroke. They're going to go through physical therapy, speech therapy, occupational therapy, a lot of rehab depending on the deficits that they have. And also remember that they can have personality changes too. These people can have emotional ability where they cry a lot. That can be from the stroke, depending on where in the brain they had the blockage or the bleed. So it can be very detrimental. to the patient and as well as very detrimental to the family. So I think that's all I want to talk about. I think I just did that in an overall nutshell, and that is about it.